Hello, Dr. Fletcher Parker here. In this video, I'm going to be demonstrating my daily spinal hygiene routine. This is a great routine for acute spinal pain or just as a daily mobility practice to keep your spine moving. We start this routine with cat-cow. This is a yoga exercise that is just touching on a couple of the end ranges of our spine here. So we're going to flex here and tuck our tail. We're going to extend here and squeeze our shoulder blades together. We'll do this for 10 to 12 reps or about 1 minute. If you have some acute spinal pain while doing this, it doesn't necessarily mean it's a bad thing and you should stop. If it flares you up or you feel worse off afterwards, that's an indication to stop doing the exercise and either call the office or just wait till you have your next appointment so we can investigate some of these things. So that's the cat-cow. After the cat-cow, we transition into a thread the needle. We reach through and then we reach up to the sky. I like to alternate my arms because it just takes some of the pressure off of the shoulders. Makes it easier to do for a little longer in my opinion, but you're welcome to continue to rep out the same side if that feels better for you. Same as the cat-cow, we're going to be doing around a minute of these. And same as the cat-cow, if it causes some spinal discomfort, you can go to the pain, but not through the pain. Meaning, don't try to push this and get more range of motion than your spine wants you to have. Again, if you get flared up after this exercise, it's a good indication it might not be the best for you. The point of this routine is to feel better afterwards. So again, I'm alternating arms here, reaching all the way through and then reaching to the sky for a thread the needle exercise. The last part of the spinal hygiene routine is a child's pose, but with some lateral bending added to this. I'm reaching all the way out while sitting back on my haunches, and then I walk my hands to one side, take a deep breath, and walk to the other side. I like to continue moving with this, but if you want to hang out for 5 to 10 seconds when you're bent to the side because it feels good or it feels relieving, you are welcome to do that. I just would not hang out there for too long, maybe 10 seconds maximum, a few deep breaths, and then continue to move through this. It's just been shown that doing a more dynamic stretch rather than a static stretch gives us a little more bang for our buck. It's a little easier to get some of the same results without also sensitizing the spine too much. So it's less likely to irritate your spine if you're not doing a prolonged stretch. That's why I like to make movements out of this. So again, this is the lateral bending child's pose, and putting all three of these together, the cat-cow, the thread the needle, and the lateral bending child's pose, is what I call a spinal hygiene routine. Again, it's really good for acute spine pain or just as a daily mobility routine.